matter how you try to run away from it, you will always come in contact with it. One of the major challenges of most nursing students is writing a good nursing care plan. But guess what? We will be having a 1-week intense class on how to write a good nursing care plan, nursing management, and also nursing process. And we will be doing that with the use of videos on our YouTube channel, audios and pictures on our Telegram platform. For those that have not registered for our Telegram platform, you are missing a lot. To do that, kindly send a message to the WhatsApp number showing on your screen. Good day everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as the Nurse with the Difference, and I make learning easy and accessible for students. Today we're going to be giving you a brief summary of what the care plan is all about. But before we go into details, kindly click on the subscribe button, turn on the notification button so you don't miss out. Let's go there. Right, welcome back. Like I earlier said, today we're going to be talking about the nursing care plan. Let's analyze it a little. Nursing care plan. Nursing is already telling you that a nurse is going to be performing this duty. A nurse is going to be caring for someone. Care. Nursing care. A nurse is going to be carrying out his or her duty of caring for someone. Then the plan attached to it simply tell you that, oh, this care is not just coming like that. You have to plan that care. You have to organize that care. That is why we say nursing care plan is a part of the nursing process, which outline the plan of action. It's outline the plan of action that will be implemented in a patient's care. So whenever you're hearing about nursing care plan, they keep telling you nursing care plan today, nursing, it's already telling you that, oh, this is the plan of action. This is the organized way that I'm going to be taking care of my patients. Then also, it is a process that includes correctly identifying existing needs as well as recognizing potential need or risk. In nursing process, in nursing diagnosis, you are identifying the particular needs of the patient. It could be the potential need or the actual need of that patient. And that takes us to the various types of nursing care plan. There are basically two types of nursing care plan. The first is the informal nursing care plan, and the other is the formal nursing care plan. We've heard of informal and formal letter then. Informal nursing care plan is in the mind of the nurse. It's not documented, it's not written down. When a patient is rushed into the hospital, the nurse starts thinking, start organizing things, start planning the care, and start implementing those care on that patient. So informal care plan is in the head of the nurse, is in the mind of the nurse. Then the other is the formal nursing care plan. The formal nursing care plan is the one that is being documented, the one that is written down in an organized format. You write it down. Oh, the number one, this is what I did for my patient. You write it down. It's organized. But the informal is not written down, but rather it is in the mind of the nurse. This formal nursing care plan is divided into two. We have the standardized nursing care plan and the individualized nursing care plan. The standardized nursing care plan has to do with the care of a patient, a group of people. That is standardized. But individualized nursing care plan has to do with the care of an individual. So that is the major difference between what your standardized nursing care plan and the individualized nursing care plan. The standardized has to do with a group of people, and the individualized has to do with what? An individual, as the name implies. Remember, we basically have two types of care plan. We have the formal nursing care plan and the informal nursing care plan. The informal nursing care plan is in the mind of the nurse, and the formal nursing care plan, it is written and documented. Then that takes us to the importance of nursing care plan. The first one we have here is individualized care. Nursing care plan helps to give each individual their own particular care. I have never seen in a hospital setting where one particular care plan is used for 10 individuals, but rather each individual has their individual care plan. Then the second is it helps in setting priorities. In our exams, you see the question in order of priorities, solve 3 nursing diagnoses. It makes you, it arranges you, it's arranged your problems, the problem of the patient in order of priorities when you draw the nursing care plan. Then order, it promotes systemic communication. When your care plan is well organized, it communicates to other healthcare practitioners, to other healthcare people about what the nursing has been doing so far. When they flip through the fluid chart, they flip through your observation chart, they also flip through your nursing care plan chart, and it shows them, it communicates to other healthcare practitioners what you have been doing. Then also continuity of care. Whenever I diagnose a patient, I make a nursing diagnosis, I start it. It's possible I am not going to be the one to evaluate it at the end if the goal was met. Because some goals are met 3 days, 2 days. I will not be on duty throughout the day. So it helps in what? In continuity of care. It facilitates coordination of care among healthcare workers, among nurses. It makes the care of the patient to be coordinated. Then it defines nurse's role. Yeah, nursing care plan. It defines your role as a nurse, and also it defines the client's goal. Nursing care plan defines the role of a nurse and defines the client's goal. That takes us to the objective and components of a good nursing care plan. Now let's talk about the objective of a good nursing care plan. The first one we have is promote evidence-based nursing. What do we mean when we say evidence-based nursing? We simply means nursing practices, nursing actions that are backed up with research, that are backed up with facts, that are backed up with critical analysis. So with a good nursing care plan, it will help to what? Promote evidence-based nursing. Then the other is it supports holistic care. When we say holistic care, what do we mean? Holistic care simply means caring for an individual as a whole, not just the physical need, but also the spiritual, psychological need involved in that care of the patient. Then the other is establish program such as care pathway. Another objective is that it helps identify and distinguish goals and expected outcome. The other one is it helps review communication and documentation. And the last objective is measure nursing care. Then that takes us to the various components of a good nursing care plan. The first thing and the most important thing I want you to take note of when writing your care plan is to put on your headings. Always put your heading. It helps to know what this care plan is all about and who this care plan is for. So it's going to be nursing care plan of Mrs. Mary with CKD. I'm not telling you to abbreviate. CKD is simply talking about chronic kidney disease. It depends on the disease condition of your patient. So you write nursing care plan of Mr. This with this disease condition. That's the first thing. Then also, the nursing care plan has 5 major headings. 5 what? 5 major headings. The nursing diagnosis, objective, intervention, rationale, and evaluation. The first heading is the nursing diagnosis. We are going to be talking about nursing diagnosis properly in our next class. Then the other is objective. The objective is like, what do you aim to get? What are your goals? What do you tend to achieve when you now know the problem of the client? Then the other is nursing intervention, the rationale. The intervention and rationale goes hand in hand. They are brothers and sisters. Then the last is the evaluation. Normally, the least nursing diagnosis they normally ask in the exam hall is usually 3. They will ask you 3 nursing diagnoses solved in order of priority, 3 nursing diagnoses. Same apply if you have 3 nursing diagnoses. Definitely you are going to be having what? 3 nursing objective. Then the other is intervention and scientific rationale. The scientific rationale for each nursing diagnosis, you should be dropping 4, at least 4 scientific rationale and nursing intervention for each nursing diagnosis. Then the objective and evaluation, they go hand in hand. When drawing the nursing care plan, advise students to create a bigger space for intervention and rationale, because they take a lot of words and they take a lot of writings. So a bigger space is advised for what? Intervention and rationale. Very much for staying tuned. Thank you very much for watching our videos. Don't forget to like, don't forget to drop your questions in the comment section. Don't forget to register for our Telegram class to have access to all our lectures, all our voice notes, and also access to our question and answer section group. And don't forget to share this video with a friend if you got value. See you in our next class. Bye.